So Celexa was first approved for medical use in the United States in 1998. And by 2018, it was the 35th most commonly prescribed medication in the United States, with more than 22 million prescriptions. Welcome back, Straight Talkers. Today I'm going to talk about the medication Celexa so that you can be better informed when deciding whether or not to start this medication. But first, make sure you hit that subscribe button so that you can be the first to know when new content comes out. So Citalopram is the generic name, and Celexa is the brand name. The generic medication has the same chemical formula, but it may or may not be exactly the same strength as the brand name medication. Also, some of the brand medications might contain various dyes or other components that can cause allergic reactions. So it's always a good idea to talk to your doctor or pharmacist about whether or not it's important to use the generic or the brand version of the medication that you're being prescribed. So how does this medication work? Celexa is considered to be a selective serotonin reuptake inhibitor, or SSRI for short. And on a basic level, it works by increasing the amount of the neurotransmitter serotonin in certain parts of the brain. In adults, Celexa is FDA approved for the treatment of major depressive disorder. It does not have an FDA approval for the use in kids. However, it's often used off-label and can treat several other conditions, including obsessive compulsive disorder, post-traumatic stress disorder, social anxiety, panic disorder, and premenstrual dysphoric disorder. The typical dose range for this medication is between 20 to 40 milligrams daily. And an interesting fact about this medication is that its maximum daily dosage was reduced to 40 milligrams daily by the FDA in August 2011 due to data suggesting that it can cause QTc prolongation, or abnormal changes in the electrical activity of the heart, at doses greater than 40 milligrams daily. So generally, doses above 20 milligrams daily are not recommended in those 60 or older, and an EKG should be obtained in patients on doses greater than 40 milligrams per day, or those with known cardiac disease. Regardless, if I'm using this medication in kids, I'll often start at low doses to help reduce the risk of potential side effects. And my approach is always to start low and go slow, meaning that we start at a low dose and increase the dose gradually and slowly over time with the goal of finding the lowest effective dose. Celexa comes in tablet and liquid form, and it is usually only taken once daily by most people. Once this medication is started, it usually takes a couple weeks before you start noticing a difference. And in many people, it can take a whole 1 to 2 months before it reaches its full effect at the prescribed dose. And because of this delay, I often recommend starting therapy during this time because the benefits of therapy can be seen right away. And the goal of treatment with this medication is complete remission of current symptoms, as well as the prevention of future episodes. Now let's talk about potential side effects. It's important to realize that many side effects are often dose dependent, meaning that the likelihood of getting them increases as the dose increases. Some are also time dependent, meaning that they begin immediately upon starting the medication or whenever we make a change to the dose of the medication. But what we typically see is that the side effects will go away with time as your body gets adjusted to the medication. So the common but usually more mild side effects of Celexa includes nausea, dry mouth, somnolence or insomnia, increased sweating, tremor, diarrhea, ejaculation disorder, dyspepsia, fatigue, upper respiratory tract infection, and rhinitis. The more serious but less common side effects could include increased suicidal thoughts or actions in those under the age of 25 years old, serotonin syndrome, increased chances of bleeding, manic episodes, seizures, or low levels of sodium in the blood. If you or your child are experiencing any of these side effects or any others that weren't discussed, please talk to your physician so that they can work with you on determining the appropriate next step of action. It's also important to realize that taking multiple medications at the same time may cause one medication to not work as well, or it can lead to an increased likelihood of potential side effects. So you should always talk to your doctor or pharmacist before starting a new medication, and make sure your doctor has an up-to-date list of all the medications that you're taking. And this includes not only the ones that are prescribed to you, but also the ones that you may have purchased over the counter or on the internet. When someone is put on Celexa, it's ultimately unknown exactly how long they will need to be on the medication for. However, research suggests that once someone's symptoms return to baseline and they're back to feeling normal again, they should continue the medication at the current dose for another 6 to 12 months to help prevent relapse or recurrence of symptoms. When deciding to come off of Celexa, please do not stop taking this medication without talking to your doctor first, because they can help work with you to come up with a plan on how to stop the medication. And my approach is to always gradually reduce the dose rather than abruptly stopping the medication whenever possible. And the main reason is because doing so can help prevent uncomfortable withdrawal symptoms. And these symptoms can include things such as trouble sleeping, nervousness, irritability, dizziness, and flu-like symptoms. So make sure to let your doctor know if these symptoms start to occur when you try to come off of the medication, because there are different approaches that we can take to help reduce the likelihood of these unwanted effects from occurring. Now head on over to the next video to find out more ways that you can help your child live their best life.